Now we will continue from 3 minutes, huh? I will keep 3 minutes. Now continue from
Okay.
there, okay?
At that point, I had said, okay, so I'll refer to you to a psychologist who will try to find out what is the trigger factor and help you with relaxation techniques, Mrs. Aziza. Is
Okay.
it fine? You agree with
Yeah.
me?
Yes, I agree with you. But okay, how long will they give us some solution? I need some solution. I want my child out of this headache.
Definitely, we both want. In fact, Mrs. Aziza, we are at your side. We want Mohsin to come out of this, and we don't want him to suffer. That's why these relaxation techniques are going to find out what is the reason why is he having this kind of a tension headache, okay? And we'll kind of find out the solution with this, and they will definitely kind of give the reason about it. They'll try to find out the reason, and once the trigger factor goes away, his sleep, his diet, everything is in place, his headache should come out. What do you feel, Mrs. Aziza?
Yes, I think we will go, but I need to start as soon as possible some therapies for him so that he's out of the headache. This is my worry.
Yes,
Because all these
yes,
days
Mrs.
I did not do anything. I just went to the GP and he did some investigations and he said he's fine. So I want to
Yes,
intervene something so that we may come out of this.
yes, Mrs. Aziza, I know to see the your boy suffering is definitely a difficult task. So, Mrs. Aziza, is it fine if I summarize what we've discussed in a meeting?
Yeah, sure.
Where Mrs. Aziza, I told you that Mohsen is presently suffering from a tension headache. He presently per se does not have any alarming symptoms, which I have explained to you, like the early morning headache, any headache waking up from sleep, okay, and having any vision problems or weakness or fits anywhere in the body. These are some of the alarming symptoms that are there. At the same time, Mrs. Aziza, I have even told you that we'll refer him to a psychologist in order to find out the trigger factor. Are you with me, Mrs. Aziza?
Yes, I am there with
I
you.
will even hand over you certain leaflets about tension headache and stress headache, and how can we help as a team for Mohsen to come out of this, right? Yes.
Okay. Yes.
And even I told you about painkillers, which we may not give for a very long time so that he does not get habituated to these painkillers. Yes.
Okay.
And you have, and we even during the meeting you'd asked suggested for a scan, but I explained to you that right now there is no reason for any scan, but if in future required, if any alarming symptom present, we'll definitely go ahead, Mrs. Aziza.
Okay, sure, doctor.
We are over here, Mrs. Aziza, to help you at any point
Thank
of time.
you.
You can come back. Okay, thank you. Thank
Okay.
you.
Thank you.
Shall I comment? Like when she asked repeatedly, and that's all. Like from my side.
Yes, for me also, you shouldn't ask questions. So when you ask the question, then again brought you back to the communication. Like you asked me, tell me the treatment. No. All the information, whatever is given to you in the scenario is the only information. You will not ask any question. You will only tell as if you know completely about the child, that you know about the child, that the severity of his headache is 5/10 and it is all over and it is not progressive. It's 5 months, but it is not progressive. And also he's
And one more.
improved with sleep and at the weekends, and school performance is good. No red flags like vomiting, weight loss, or vision, and investigations are normal. You know everything. You will not ask her anything. No,
And
asking, I
you
think
shouldn't.
twice you asked in
uh,
the session.
Yeah, you cannot ask. And one more thing, you cannot say like in if in future, like something like this we will do. Like no, because diagnosis is already very clear. They have given you clear diagnosis as this tension headache.
No,
Like
this
you need.
diagnosis can anytime change. There is still a possibility that the child can have.
Yeah, it can, but once they made the diagnosis like this, just you have to communicate with that. Like I know, I understand your point, but once
I
they have
just, because you have to
cleared you
say
the.
the alarming symptoms, I just happen to say that, if these are the alarming symptoms, just come back. We will think.
Yes, but I think they can deduct the mark for this. I think so. like they can detect the mark. Like if you say so, like if in future required we will do this, because once they have made the diagnosis of tension headache, I think you said very nice, like we will involve psychologists, will be a multidisciplinary team and this and all. But I think this can detect, like I think so.
You told only psychologist, right? Anyone else did you tell?
Psychologist and therapist, I just means they generally the ones who do this relaxation techniques and stuff. I didn't get what. I did not say anyone else. Right? Should we say neurologist? I did not think of a neurologist because there is no red flag sign.
I think you can tell there is no harm in involving. There is no harm.
Hello. Yes, regarding this, we can also tell the headache clinic, because it's from 5 months. If she is so much worried, you can also refer her to headache clinic. Okay.
Okay.
Like yesterday, we were discussing about the headache clinic.
Okay.
Right. I think we will repeat this tension headache. Okay. See, the main question here, mother, it will be the main role here is mother will be demanding for imaging. And you will be convincing her that no, this is tension headache, no need for imaging in different ways. Okay, this is one thing. Another thing you missed was you can also tell her that she will keep a headache diary. Okay, to see that how often he gets the headache, she will record it. And is it associated with sleep? Already like means anything she will record, like about the school, about the sleep, anything. She will just record for herself. And also, if there is, you will tell her that whenever he has headache, the first thing will be to give good rest. And also, if you don't know, you will not ask her a question, but you will just give a suggestion that if he is watching I mean the screen time, if it is for a long time, he will reduce it, and he will take more rest during that time. And also his playing time can be reduced during the time of headaches, to give the rest and sleep, because sleep will improve him. It's given here, no, after sleep he feels better. So whenever he has a headache, he should take the rest. This is the first thing you will tell. And you will tell that when if you will give the painkillers only if there is a lot of pain, which you told already. And you told that you should avoid. This was good point. And you will also give her the red flags. Yeah, she should know the red flags, like vomiting, sudden onset of headache. Like this is now non-progressive, but if there is any increase in intensity or having problem in vision, walking or anything, she has to inform us. Then you told about leaflets and trusted websites, which is good. Regarding the management, again, enough good rest. And if there is any problems in his lifestyle changes, then the mother should maintain the symptom diary over a period, so that we will clearly get to know when he is getting the attacks and how is it. And red flags. Regarding the referrals, for me, you can refer to the psychologist and the headache clinic, and also behavioral therapy. Okay, this is what I want to tell from my side. If anyone wants to comment. And also for the imaging, you can also tell that benefit versus risk. Here there is no much benefit for him, because already his sleep is good, because it's already told that he is sleeping well. And when he sleeps well in the weekends, he has no